how we attract people, warriors to come into this program to find that willingness to commit to 2 weeks of intensive treatment in full transparency is not always an easy sell, because we're asking them to commit to addressing and facing experiences, memories that they've been working really hard at pushing down. And they're pushing that down so that they can get through their day. And so we're asking them to come into treatment, and we're not asking them to work any harder than they've already been working. We're asking them to work differently. We're asking them to be open to approaching their experience in a different way, knowing that this treatment will be tailored to them, to their unique needs. Certainly the symptoms of PTSD and the other invisible wounds of war share similarities, but they present differently based on your personal experiences. And so I think that's a really important point to emphasize, that this isn't a cookie cutter approach to treatment. I think that we at Warrior Care Network do a great job of normalizing and labeling the ambivalence about coming into treatment to address these really difficult things. And that's why we incorporate the other treatment modalities. We're not asking you to come in 8 hours a day and talk about the worst thing that you ever experienced. We're going to do some of that. And we're going to approach treatment from a variety of different avenues. And so that's where the music therapy comes in. That's where the art therapy comes in. And I think art therapy is one of those aspects where, somebody that was an infantryman or, a Marine that was out there, kicking in doors is going to say, what am I going to do with art? And it's an incredibly eye-opening experience to process something so difficult in a somewhat non-traditional way. And so we have all of those talking points. We have our incredible outcomes that we openly share with warriors that are interested in treatment. And then we also, through Wounded Warrior Project, work very, very closely with that warrior to overcome any barriers to treatment, whether that's financial, whether that's looking on how to get assistance in applying for FMLA, leave from your employment. Anything that kind of comes up, any stumbling block that comes up, we're providing resources so that they can overcome that and get into treatment. Their job is to be willing to come into treatment, and we're going to help them get here.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.